And I want to thank our two presenters today for coming. And you're more than welcome to begin whenever you're ready.
Well, first of all, I'd just like to thank both speakers for coming today, Julia Schleimer and Dr. I'm Dr. Ali Rowhani-Rahbar, who's here to speak to us on gun violence prevention and what's possible. We really appreciate that both of you have come to speak to us on this important topic. I wasn't officially supposed to do your introduction, and I wonder if you could introduce yourselves because of the lack of my information right now, and then we can go from there to your talk.
Julia, you go ahead.
Okay, great. Hi, everyone. My name is Julia Schleimer. I use she, her pronouns, and I'm a third-year PhD candidate in the Department of Epidemiology at the University of Washington School of Public Health and a trainee with the Firearm Injury and Policy Research Program. And I'm very excited to be here today and to share a little bit with you all about the field in general, some of our work, and then have a conversation.
Yes, thank you so much for having us. I'm Ali Rowhani. I am a professor in epidemiology and pediatrics at the University of Washington, and I'm currently the interim director of the Firearm Injury and Policy Research Program and starting as the director next Monday. So really delighted to be here with you all. So I think, Julia, we should probably then start. Good.
Great. So Ali and I are going to sort of tag team this presentation, and I'm going to start with the first part, and then I'll pass it over to Ali. So as we said, the sort of title of our talk today is Gun Violence Prevention, What's Possible? And here's a brief outline of what we'll be talking about. So the burden of firearm-related harm, the costs of firearm-related harm, policies to mitigate firearm-related harm, a bit about community-engaged research and some of the work that we are doing, and then time for Q&A. So diving right in, this figure shows rates of firearm death nationally from 1982 to 2021 by intent. And as you can see, rates of firearm mortality have increased substantially in recent years. The uptick started around 2014, reversing a decades-long trend that had started in the mid-1990s, a downward trend. But rates really increased precipitously beginning in early 2020. And in 2020 and 2021, the US saw the highest number of firearm-related fatalities on record, reaching above 48,000 in 2021. And in 2020, firearm-related injuries became the #1 leading cause of death among children in the US. While firearm suicide rates are still higher on average than firearm homicide rates, as you can see from this figure, the recent increase in overall firearm death rates was really driven by firearm homicide, with a 45% increase from 2019 through 2021. And the last time the US saw comparable rates of firearm homicide was in the late 1980s and early 1990s. And it's important to note that I'm showing fatalities here, and fatalities are the most sort of valid data that we have on firearm-related injuries. But for every firearm death that occurs, many more people are non-fatally injured and experience relational and vicarious trauma. And so these figures here show firearm suicide rates nationally from 1990 through 2021 for different subsets of the population defined by sex and racialized group. The orange line here is the mean rate, so the average rate across all age groups for that population subset. And the blue line is the highest rate for any age group annually in that population subset. And so what we see here is that firearm suicide rates are generally highest among males, particularly white males. We also see an uptick in firearm suicide rates among marginalized populations, especially Black males in recent years. And in fact, provisional CDC data from 2022 show that for the first time, firearm suicide rates among Black teens have surpassed the rate among white teens. And other racialized groups are not included here because the numbers are too low to sort of present and maintain anonymity. But we know that American Indian or Alaska Native populations also have some of the highest rates of firearm suicide of any racialized group. And these figures are similar, but now focusing on firearm homicide rates. And again, the burden is generally higher among males than females, although notably, rates of firearm homicide among Black females are sometimes higher than rates among white males, revealing the intersectional nature of the problem. And the magnitude of the inequity in firearm homicide is really staggering, as we see from these figures. The highest ever recorded rate of firearm homicide between 1990 and 2021 was among non-Hispanic Black males aged 20 to 24 in the year 1993. And that was a rate of 183 deaths per 100,000 population. In stark contrast, the highest rate of firearm homicide among non-Hispanic white males of any age group that year, 1993, was less than 10 deaths per 100,000 population. And in 2021, the highest age-specific rates of firearm homicide among Black males and white males were 142 and 6.3 deaths per 100,000 population, respectively, showing that we've really not made significant progress towards reducing these inequities over time. And it's also important to note here that race and sex differences in firearm-related outcomes, both suicide and homicide, are not rooted in biology, but reflect social and structural factors that shape risks and resources. So now we're going to sort of look at cross-state comparisons. And this figure shows the rate of firearm death by state ranked from highest to lowest in 2021. And we can see that Washington has a below average overall rate compared to the nation as a whole. And also compared to some other states, a larger share of firearm suicide deaths. Almost 70% of all deaths, firearm deaths in Washington in 2021 were suicides, and about 30% were homicides. And nationally, in 2021, about 54% of firearm deaths were suicides, and 43% were homicides. And then to zoom in a little bit further, looking at within state variation in the distribution of firearm deaths in Washington. This is from 2010 through 2020. We see that death rates are higher in the Northeast and some Western parts of the state, and are relatively low in King County compared with the rest of the state. And in King County specifically, the distribution of firearm deaths is pretty similar to the state on average, with 68% of firearm deaths due to suicide. And I'll now pass it to Ali.
Great, thank you so much, Julia. So, in light of the burden and harm that Julia just described and summarized, we want to talk to you a little bit about the cost implication of gun violence in the United States. And of course, whenever we talk about costs, this question comes up, which is, well, costs for whom? For survivors, for families, for employers, for the US government, and what type of cost we're talking about, out of pocket and directly measurable ones, or indirect costs, or intangible quality of life costs. And the answer to these questions is all of the above, essentially. So there are estimations that have been done by different groups. I'm going to share one of them for you here. The next slide, please, Julia, where they have estimated about $557 billion per year. That's the cost of gun violence in the US. And we are talking, when I say gun violence, I include different forms of firearm injury. So these are any intent, whether it was self-harm or interpersonal harm or police shootings or unintentional and accidental shootings of different people, including children. And as you look at these numbers, of course, you will see some striking differences in different buckets. And of course, the medical costs is big, but really, relatively speaking, when you think about work loss costs, and especially quality of life costs, you really gain an appreciation of when we are losing these dollars in terms of how gun violence affects our communities, what age ranges are impacted the most, and the life that is lost, the lives that are lost, and the cost of those for our society as a whole. Of course, it's impossible to put a number on life lost or life changed or harmed, influenced negatively forever. It's hard to put a number on it. But I think it's helpful to think about, broadly speaking, as we think about what is it actually doing to our society, and compared to some other leading cause of death, you gain an appreciation and can put this in the appropriate context. Next, Julia. And so these are some of the exercises or estimations that Everytown for Gun Safety has done with the help from some economists and researchers in PIRE. And you can see across different states, obviously, as you think about per person cost of gun violence, it varies greatly. There's no doubt about that. You see the bar on the right-hand side for where the US is in terms of the per person cost of gun violence, and then you can see variations across different states. And here's an example where you can compare Washington State versus Missouri, for example, and you can see the cost per resident being higher in Missouri. To just, these are some broad estimations. They haven't controlled for all the differences between the two states. They're essentially saying, considering the existing laws and policies and culture and socioeconomic factors and others that are operating in these two different states, look at the cost that gun violence imposes on the population in these two different states. The next one, Julia, please. So what I would like to do now is to take you back to 1990s and talk about a couple of papers that were really influential in terms of forming and shaping the future of gun violence field. Next, Julia, please. So these are the two papers that many of you probably are familiar with, or you have heard about them because they were done and led by scholars here at the University of Washington. Dr. Fred Rahbar, who is with us here today. I see Fred obviously was influential and integral to both of these papers. So Arthur Klarman led both of these influential papers in the New England Journal of Medicine back in 1990s. The first paper that he published, not that this was his first paper, but these two, the first one is the left-hand side, 1992, when he examined the presence of guns in the home in relation to the risk of suicide. And so he found that there are several-fold increases risk of suicide at home when guns are present. A year after, Arthur Klarman published the second paper that you see there, also in the New England Journal of Medicine. This one was about the risk of homicide at home as it relates to gun ownership. And these two papers, especially the second one, 1993 on homicide, really created a very, very large and strong backlash and reaction from the gun lobby in relation to public health research and medical research on gun violence. Next, Julia. And specifically spearheaded and led by late Representative Jay Dickey of Arkansas, we had this really strong, we saw this really strong pushback that essentially led to what's called the Dickey Amendment. Representative Dickey offered an amendment to the Omnibus Consolidated Appropriation Act of 1997 that specified that none of the funds made available for injury prevention and control at the Centers for Disease Control and Prevention may be used to advocate or promote gun control. And the $2.6 million that was devoted to this was entirely removed from the CDC budget and moved to other areas of research. And they were signed by President Clinton on September 30th, 1996. Next, Julia. And so with the Dickey Amendment, what happened was that an essentially era of dearth of funding for gun violence research began. And the interpretation was that essentially whatever you do in terms of scholarship and research on gun violence is gun control. And with that kind of interpretation had a profoundly chilling effect on any type of scholarship and research on gun violence, because if it's equated with gun control, then it's a non-starter. Some years later, before his death, Representative Dickey very publicly declared and announced and shared that he really regretted what he had done. And if research had been done over the past 2 decades or so, maybe many lives would have been saved or many injuries would have been prevented. He had an editorial in Washington Post and really talked about how he was thinking about this. And also along with Dr. Mark Rosenberg, who was the director of the National Center for Injury Prevention and Control within the CDC, who essentially, Dr. Rosenberg lost his job essentially because of this back in 1990s. They both came together. They were good friends, actually. They came together and really discussed the impact of the Key Amendment and what happened to the field. And there are many articles about these two now. There is a New York Times article about it. There are really interesting stories about how they got to know each other a little bit better, their families, et cetera, et cetera. But it's really, really one of the most important junctures in gun violence research, the Key Amendment. When you hear that, that's really referring to this particular amendment. Next, Julia. And so that story continued, the dearth of funding continued, lack of resources for gun violence continued for years. And really, there was not much funding available at the CDC or the NIH at all for this type of work. NIJ, National Institute of Justice, did have some funding, but it was very much from the criminologic perspective, as looking at gun violence really through the lens of gun crime and criminal justice, which is obviously one aspect of this, but it's not really the public health lens. And then there were a couple of foundations over the past 2 or 3 decades, particularly Joyce Foundation, that really did fund some research on gun violence. But of course, it's nothing comparable to what the federal government can do. The resources that the federal government has, the dollars that goes into research on Alzheimer's, traumatic brain injury, HIV/AIDS, cancer, stroke, you just can't compare it with the resources available for gun violence research. That landscape somewhat changed in 2020, when for the first time, after many, many years, Congress finally allocated specific funds for gun violence research. Not a lot, $25 million, which is not at all a lot of money when you think about the burden of this problem, as Julia mentioned, but still it's better than zero. And so that was split between the CDC and NIH, and several research projects were funded. We were fortunate to be one of the recipients of the first cycle of those funding, and then the third cycle more recently. And then over the past 2 or 3 years, more people have entered this field essentially in terms of funders. Now we see much more engagement and involvement from not only the federal government, but also the local government and state government, some research or healthcare integrated delivery organizations such as Kaiser Permanente, research institutions such as RAND, donors and philanthropy, and some private foundations. They have come together, for example, for National Collaborative on Gun Violence Research that provides funding. So the landscape has changed. And once upon a time, people like Julia would be completely discouraged from entering this field because essentially it would be the end of their career. That has changed. And with some of the resources that are still quite insufficient, but still available, we have seen also a new pipeline of emerging scholars and leaders, especially also from Black and Brown communities who are entering this field, which I think is really, really much needed and welcome change. Next one, Julia. So speaking of funding, for example, one of the first cities in the United States, maybe the first, that funded gun violence research was the city of Seattle. And this is how actually I entered the field after Sandy Hook, which after Sandy Hook, the city of Seattle decided to fund research on gun violence research because they really understood at that time, this was back in 2012, if you remember December 14, 2012, when Sandy Hook happened. They realized in 2012, 2013, that really there wasn't a lot of resources. There weren't a lot of resources for this type of work. So the city of Seattle provided exactly $153,000, and you can see articles about it all over the internet if you search, to Dr. Ibarra's group and us, and that's how I joined, and that's when I joined, to do this study that you see on the screen. One of the first studies ever that looked at the relationship between getting shot and the subsequent risk of getting shot again, but also involvement with the criminal legal system. In this study, what we did in Washington State, we probabilistically linked the record, the hospital record of all those people who had been shot and been hospitalized in Washington State, including at Harborview. And we linked their record to their prior arrest and conviction records and hospitalization records. And then after that, after they were released from the hospital, their subsequent risk of getting hospitalized or getting arrested or getting murdered. And the numbers from this study were absolutely striking, very, very striking. We found that those people who had been shot and they had been hospitalized in a hospital in Washington State, they were 21 times more likely compared to other patients to get shot and come back again. Just think about that numbers, 21 times more likely to get shot again and come back. This is a revolving door. When we talk about acute trauma being a chronic condition, when you go back to the same communities, to the same harm, to the same structural problems that are dominating, and you get shot again and again and again. They were 4 times more likely to get murdered compared to other patients in the hospital. And they were 3 times more likely to get arrested for violence compared to other patients in the hospital. We're not talking about thousands and thousands of people. We're talking about 600 people who had been hospitalized because of a gunshot wound and survived, went back to the community in Washington State. But a relatively small group that disproportionately faces the highest burden of involvement in violence, whether as a perpetrator or as a victim survivor. We say hurt people, hurt people. There is not such a dichotomy between a perpetrator and victim. It's a cycle. And so we need to do something about this. And this is one of the first studies that essentially paved the way for this amazing program at Harborview Medical Center that is done on violence prevention intervention, one of the hospital-based, community-based violence intervention program led by my wonderful colleague, Dr. Deepika Nehra, and her team, who are doing amazing work to improve the lives of these very people who come to Harborview. Next one, Julia. And so that's as it relates to the type of work that can be done at the individual community level. I want to end my session here and then turn it back to Julia to talk about some of the work that we are doing right now. I want to talk about policy and going to the outer layers of the so-called social ecologic model. There is work that has been done that really documents what we know about gun laws and gun policies. And this picture perhaps summarizes this the best. Of course, there are books and documents and 500, 600 page PDFs I can share with you if you're interested, but this probably says a lot of the stories. In this so-called Sankey diagram, you can see the relationship between each of these laws and the outcome, the law on the left-hand side and the outcome on the right-hand side. What kind of policies may reduce the risk of this outcome? What kind of policies may increase the risk of some of these outcomes? As you can see, these are the type of policies for which there is some evidence of effect of action. There are so many other policies that we still need to study, but these are some of those that are they have solid evidence behind them or suggestive evidence behind them. And we continue to do these studies to really add to this evidence. But I wanted to share this with you to see very clearly that there are policies that have been shown to be effective. And our job is to really try to see if we can implement them, those that reduce the risk in an effective manner. Next one, Julia. I really want to emphasize this point as well. It's not just gun policy or just gun laws. Of course, you can't solve a problem as intractable and as complex as gun violence and multifactorial with just one solution. You can't. It would have to be a multi-level solution to it. There's no magic formula for just magic solution, one solution. It needs to be multi-layer, multi-level. And when it comes to policy, in addition to individual level, community level, school level, peer level interventions, when it comes to policy at the societal level, I think it is not doing justice if we completely just focus on gun laws, because there are social policies that could also be really, really impactful in terms of reducing violence. Some years ago, with Dr. Ibarra and some other colleagues, we began a study on the relationship between earned income tax credit policies, state EITCs, and different forms of violence: child maltreatment, intimate partner violence, sexual violence, suicide and suicidal ideation, youth violence. And we found a really powerful impact of reduction of violence among states that had more generous income tax credit policies. So that's just an example of the type of social and economic policy that could reduce violence. As it relates to firearm violence, we conducted a scoping review, an international global scoping review of all the studies that had looked at the relationship between income support and firearm violence prevention. We found studies in the US, in Brazil, in other places in the world where clearly there was evidence that some of these income support policies reduce the risk of gun violence. Just 2 weeks ago, another study emerged from the CDC. They looked at the relationship between state minimum wage and firearm homicide. And why are these potentially impactful? Because of all the points that Julia mentioned, because of the history of trauma, and especially the racialized minorities and communities in the country, and the impact of both economic policies and levers, but also racist policies that have really led into these profound inequities and disparities that we see. Many of these social policies do have an impact on violence, because when you think about the causal pathway in which violence occurs, you can stop it at different parts of this spectrum, different parts of this journey. And these social policies get at some of those more upstream and root causes of violence. They're not midstream or downstream, they're more upstream to really stop it from happening. And I think these are really important to keep an eye on. They are probably under-researched compared to other types of policy, but they could have a sizable impact at the population level. So I will turn it back to Julia to talk about some of our current ongoing activities related to community violence intervention.
Thank you, Ali. And that's a really sort of perfect segue to some of what I'll be talking about now. So there has been recently this really unprecedented investment in CVI, or community violence intervention. And CVI is increasingly considered an important strategy for preventing community violence and more broadly promoting health, safety, and equity. And CVI programs differ in setting, whether hospital-based, like the one here at Harborview, or more centrally community-based. And they also differ in scope in terms of the specific services that are offered. But these programs really have a similar soul to them or foundation to them, which include engaging with the relatively small number of individuals at highest risk for violence involvement, and really leveraging the expertise of credible messengers who are people who have similar lived experiences to the people that they're serving, and offering individualized intervention and support and connecting individuals to the resources that they need. And so a coalition of Black and Brown CVI practitioners, advocates, and researchers has recently done some incredible work to advocate for CVI investment. Specifically, the Fund Peace campaign, which you can see a picture of here from their website, was started by the Black and Brown Peace Consortium in 2018. And this group, quote, called for federal leaders to invest money and political will towards developing and expanding personnel, capacity, and infrastructure for violence intervention and prevention efforts, led by those who have been working to build peace in their communities for years without consistent or adequate resources. And so in February 2020, the Biden administration transition team met with members of this Black and Brown Peace Consortium. And the group came prepared with a comprehensive assessment of the research evidence, the estimates, like Ali shared, of the heavy economic and social costs of firearm violence, and also deep lived expertise and experience about the value and promise of these CVI interventions and programs. And this meeting and ongoing efforts by that group resulted in the Biden administration calling for an unprecedented $5 billion investment in CVI over 8 years as part of the American Jobs Plan. And while that plan didn't pass as proposed, the group's efforts still bore fruit in terms of millions of dollars of investments through the American Rescue Plan Act, modifications to existing funding streams like within the Department of Justice, and in the Bipartisan Safer Communities Act, which allocated several million dollars to CVI specifically. And this funding has been used to support programs here in Washington, as well as in many other states. So with funding from the Washington State Department of Commerce, sourced in part from those federal dollars, we at FIPRIP have partnered with 13 different organizations over the past couple of years to work with them to evaluate their CVI programs, their community violence intervention programs. And these organizations are all sort of shown here, their logos. They include Harborview's own hospital-based violence intervention program, Choose 180, the Seattle and King County Regional Peacekeepers Collective, East African Community Services, Clark County Mediation Services, the Port of Support and Pathways to Success, the City of Tacoma Office of Neighborhood and Community Services, the Walkabout Yakima program, the Spokane Regional Domestic Violence Coalition, BIPOC Apostrophe, Community Passageways, the Dispute Resolution Center of Grays Harbor and Pacific Counties, and the BRAVE program housed in the Seattle YMCA. And we've held several workshops with these community partners and have spent time really trying to learn about their work, build relationships, and co-develop a theory of change for their work and their programs and related evaluation measures that we can use to assess the different steps on that theory of change, including both quantitative measures and qualitative measures. And we're now actively working with organizations to collaborate on moving forward with that data collection process. And the goals of the evaluation, excuse me, are to really better understand and elevate the work, focusing not only on those important day-to-day activities, like helping folks get access to resources and mentorship and financial assistance and others, and the related outcomes like more positive self-image, economic resources, and moves towards pro-social conflict resolution. So not only those activities and outcomes, but also the contextual factors and pressures that are shaping the work, like the availability of funding and referral services in the community to direct folks towards what they need. And as you may have seen on the last slide with a picture from our last workshop, part of the conversation at that workshop was about community engaged research. And the traditional sort of research paradigm has really typically had little to no community involvement. And what we are really striving to do here with both of our workshops and other efforts is to have this evaluation be community-led to the greatest extent possible. But this is not a quick and easy process because there is a lot of earned mistrust towards the medical and public health communities. There's power differentials, and there's important considerations around representation and lived experience of the people doing the research. And so in a workshop that we held just over a week ago, we had a long conversation with community partners about these topics. First, about how those power differentials and social hierarchies show up and how they harm communities. And then we discussed ideas around what true community-led and real equitable evaluation could look like. And the possibilities are sort of endless, and it involves some really big changes to systems and structures, but it also includes smaller changes that are a little bit more manageable and immediately feasible, like sharing resources, shifting decision-making power about the study methodology, and incorporating the expertise of community partners and ensuring proper compensation for their time, attribution of their ideas, including in authorship. So I think I will stop there. Our emails are here, a little bit of information about FIPRIP is here, and I think I'll stop sharing my screen so that we can all see each other and have a bit of a conversation, but I'm happy to pull up any additional slides that folks have questions about.
Thank you, Ollie and Julia. You guys did amazing. I just wanted to say that and kind of get the discussion going. I'm Lena. I'm on the Violence Intervention and Prevention team, and I met with Ollie and Julia during their workshops and other settings too. They're doing some amazing work, and Ollie recently, has his own group too, FIPRIP. So really excited to get this question and answer started. I just want to know, what questions do you all have, or Ollie and Julia, do you have questions you want to specifically ask the audience today?
Thank you, Lena, again, so much for this opportunity. I see Matthew as well. Thank you both for having us today. No, I think it would be best to just hear the voices of our community and answer any questions that you all may have.
Ollie, if I could just start it off with kind of a quasi-speculative question. I'm always struck by how what we see is attempts by political measures to control these kinds of violent events via gun control. And I'm just curious, throughout this period, I've never seen gun control take Chris Rock's idea, which is actually just charge more for the bullets, charge more for the ammunition. And I'm just curious, in your research, if you've seen anything that looks at that, at the availability of ammunition, the availability of actually being able to use the device, because it seems like politically we're going to be, per the Supreme Court's decision, unable to control the devices. If we control what is expelled through the device, maybe there might be some possibilities there. And so this is sort of a fantasy, maybe, but I'm just throwing it out there. Just a question. Chris Rock suggested that each bullet be $5,000, so that's my 2 cents.
Thank you, Matthew. And so I'll provide some thoughts, and then Julia, please also comment as needed. Matthew, not that I have seen in terms of research evidence that, whether such an intervention or increasing, the cost is going to be associated with the reduction. And I am not saying I haven't seen evidence. That doesn't mean it doesn't work. It's just that this field has been, essentially suffocated for so long that we don't have even answer to some of the very basic questions. So, but this idea has come up in terms of whether it's, for insurance or increasing that premiums or increasing the cost associated with the bullets or the device itself or additional tax. These have been proposed in certain cities or jurisdictions have been implemented. I think it is a little bit of more of a challenge from the scientific point of view to really try to take that as a sort of a quasi-experiment, if you will, and see how those increases may be associated with reduction in gun violence, for example, because of the complexities of the nature of the question. Now, in terms of technology, clearly there are lots of conversations going on right now in terms of how we could maybe make guns less accessible to unauthorized users. So for example, the idea of smart guns has come up, and some people are proponents of that. And some people say that, you know, technology, the way we have done for medications and pills, for example, can we do something like that to really make it inaccessible, especially as it relates to children, and also in terms of crime guns as it relates to theft. But those are all based, to my knowledge, those are all conversations that have been happening. None of them, to my knowledge, really have led into something that is very, sizable or the very large scale. And part of that is, you know, we have, based on the best estimates, anywhere from 350 to 400 million guns in civilian hands in this country. So I always talk about this when people say, when you're doing a buyback program, or say, well, have you thought about the scale of what we are talking about here in the United States? We have 350 to 400 million guns. And guns also are profoundly durable, as you know. And once you have them for a long time. And so even if there are changes right now that happen at the point of purchase or with technology with new guns, there are already hundreds of millions of guns already in about 1/3 of US households, based on the best estimates. That varies from rural to urban area. And so those have always been things that people have been talking about. I think the question is whether maybe at a smaller, lower geographic, finer geographic level, like particular communities or jurisdictions, some of these could be tested to see if they have any impact. Julia, do you want to add anything? Did I miss any point in my answer to Matthew?
No, nothing to add.
Thank you, Ali. Yeah, thank you, Julia, and thank you for presenting today. I really appreciate you both.
Hi, my name is Whitney Carlson. I'm a psychiatrist at Harborview. I had a question about the trends in child and adolescent suicide and whether you're seeing any particular gender or racial changes with that as things are going forward. Because I just heard an article about social media and a bunch of trends, and I have 3 teenagers, so I'm just interested in your thoughts on that.
Julia, I will let you take this one.
Yeah, I can start. So definitely, as I sort of very briefly mentioned at the beginning, there are distinct trends among different racialized groups. So historically, the firearm suicide rate among white young people, teens, adolescents, has been much higher than other non-white groups. But that sort of trend we see converging, and provisional data for 2022 show that the Black youth suicide rate, firearm suicide rate, is higher for the first time ever than the white youth firearm suicide rate. And so we really are seeing substantial increases among marginalized and minoritized racialized groups. And in terms of differences in sex or gender, I'm not sure how those break down. I believe that it's not specific to one group over the other. And so there have been different sort of theories about why this is. You mentioned social media. I think that's definitely one thing that people are looking at, hypothesizing about. Also, there have been a lot of hypotheses around structural racism and structural violence, and that as a upstream, as Ali said, contributing factor to some of these trends we're seeing.
No, I don't have anything to add. I think you covered it, Julia, very well. And Whitney, I put also a link, Dr. Carson. I put a link in the chat box that really calls into action this really troubling trend that we see in terms of increase in suicide among Black communities. especially Black youth.
Thanks.
Hypotheses about why that may be.
I have a question for you guys about normalizing gun violence or the effects of gunshot wound injuries on the news and those types of settings. And I'm just curious your thoughts on how it's becoming normalized. If it is, what are the impacts of that looking like, in your opinion?
Yeah, thank you, Lena. I can answer that question. And I realize we also have another question in the chat box that we haven't addressed yet. So maybe after this, we'll definitely answer that question as well. The impact of exposure to gun violence really is getting a lot of attention in recent years. It was some of the more neglected areas of research within this already neglected area of research, but exposure to gun violence was something that people really didn't look into it. But we have increasing evidence in the past few years, and I'm happy to share any of those papers that you might be interested in that really shows how, whether it is media or direct exposure, so direct or indirect. So direct could be that you live in a neighborhood where you're constantly exposed to gun violence and gunshots, even if you're not yourself getting shot, but you see people who get shot or you hear gunshots. That kind of exposure, but also exposure through social media and through movies and others, really does have an impact, does have a profound and powerful negative impact on a variety of aspects of both mental health, cognition, and behavioral health and physical health. And so it is something that is really, really powerful in that really calls for actions to really uplift entire communities, because many communities are suffering through that collectively. Sometimes we just focus on who dies and who gets shot, and we forget about all other actually larger areas of this pie, if you will, the entire pie of firearm-related harm, and the slices that are not about injury or death, but about different forms of harm, including exposure to gun violence. We have research that shows these exposures could lead to depression and anxiety, poor academic performance, really utilization of different types of medications at levels that are much, much higher than other communities that are not profoundly impacted, and also how it impacts what's called collective efficacy of an entire neighborhood, how closely tied people are, integrated they are together in terms of the activities within the communities, that really the fabric of the community falls apart. And then the impact of that on the economy of the neighborhood. People start leaving that area, and those who are most vulnerable actually are left behind. So this cycle continues. So I really think that's a really important question. Also, there's research that shows children and adolescents who are exposed to violence or violent scene or events, they are more likely then to also engage in violence or touch guns or shoot guns. And so that's something that's really, really important, and we really badly need interventions and credible messengers that could disrupt that cycle of violence.
And Ali, I see Dr.
Yeah.
Sam Bobby here at Harborview. Sam, do you have a question for our panelists?
Yes, I do. First of all, thank you to the panelists. I really appreciate it. Second is the question. You know, you showed the data that since 2020 it went up, and depending on what political faction you talk about, they point to number of police officers and as a factor. And I have not seen it, and I don't know if there is such a thing. That is there a relationship between homicide and I assume I don't see any factor with suicide, but maybe suicide, that the number of police officers or laws that cause more strict prison or other things that affect the homicide rate in the society. Do you guys see any data? Is there some research in that?
Julia, do you want to start with that and I will comment?
Sure. Yeah, that's a great question. Thank you. My understanding of this research is that there's not great evidence to support the addition of police officers or more punitive law enforcement policies on decreases in homicide or firearm homicide. So for example, we had really large sort of investments in sort of so-called tough on crime policies in the 1970s and 1980s, where we had mandatory minimum sentences, truth in sentencing laws, 3 strikes laws, stop and frisk, these sorts of things. And that really contributed to a large boom in the prison population, this mass incarceration. But the evidence shows that really that didn't track with rates of firearm homicide at a national level, and rates of firearm homicide had sort of already been on the decline at the time those policies were implemented. So I think overall, the evidence is not strong there for that being a protective force. And also, there's a lot of research on the harms of policing as well, and the harms that over-policing and over-surveillance cause, especially to communities of color. And so that's just another aspect to keep in mind holistically for thinking of those sorts of strategies.
Julia, can I push you on the obviously the punitive, we all knew about it, and that's great, and I love your response. When you say whenever we say there is no evidence, it could mean that people studied it and couldn't find any association, or that there's no evidence because people didn't study it. With the number of police officers, the punitive one, I 100% agree, and that sounds great. And I think one of the important things is when we want to find a wave, we shouldn't follow the wave, we should be in front of the wave. So the reason I'm asking this is it would be great to know and tell people, no, you see, hey, listen, this is not that people will listen, but maybe having the data is good. With the police officers, when you say no evidence, does it mean people studied it and showed no association, or that there has been no study?
Yeah, thank you for that sort of follow-up. That's a great point of clarification. And people have studied this question, and my understanding of the evidence is that it's not sort of a consistent, strong protective force that they're finding in those studies. I think there are definitely some studies have shown that policing is related to rates of violence, but on a more holistic level, my understanding of the evidence that has been produced is that that's not necessarily the sort of consistent story or large effects, but Ali can sort of add and correct me.
No, not to my knowledge, Dr. Arbabi, Sam, it's really great to see you. No, not to my knowledge either. If you're talking at the population level, like quantitative as opposed to like quantitative studies that look at the relationship between number of police officers and, let's say, reduction or increase in gun violence, I haven't seen that one either. As you know, there are different policy analyses and policy evaluations that control, as you know, as a covariate, for example, in a model, number of police officers per population or number of arrests made in the population as a determinant of what happens in terms of homicide or exposure to criminal legal system, because arrests are the indicator of exposure to criminal legal system, right? It's not evidence of perpetration. And so that we have seen, but not to my knowledge, a body of scholarship that quantitatively looks at the exact number of police officers, to my knowledge, but something to look into the sociology literature on that as well to see if we can find any and get back to you.
No, thank you very much.
Of course, it's great to see you, Dr. Arbabi. I see Dr. Lindo's.
Yes, and we're running a little short on time, so I wanted to make sure to let folks know that they are able to leave, right at the top of the hour. But this might be a very interesting question from Dr. Lindo, so I will let him go ahead if that's okay. And then we can close after that, if folks don't mind.
That'll be great.
Thanks so much, Lena.
Also, thank you, Dr. Lindo. I just wanted, just before everybody leaves, though, just to thank Ali and Julia for providing this great presentation. presentation today. And additionally, we just want to acknowledge Dr. Rivera's work, his longevity in this field and his contributions. It's all of you really very much appreciated. Thank you.
Yeah, thank you for that. No, thank you for the presentation, and I'm so glad that it's getting spread and heard from folks throughout the community and what you all are working on. The question I have, and I've always had this when I look at research on gun violence, is the question of at what point do we begin to include the gun violence perpetuated by law enforcement as a contributing factor to gun violence, as both an end, but also perhaps even the cascading effects, like you said, Ali, that when you hear it, right, when we say we hear the gunshots, it also is those gunshots that come out of a holster in someone wearing a blue uniform. So it also has a ripple effect in a negative way. But I'm wondering, and I've heard the reasons why folks say they don't add it, but I'm wondering, can we explore in the difficult way, how do we include it to have a meaningful impact in the ultimate outcomes of the data?
Thank you, Dr. Lindo, for asking that question, which is a really, really important one. So I'll just share some thoughts and reflections. I won't have a perfect answer for you for sure. It's just you're making me think about this more here and just reflect on some of these issues. I think so some people may not, as you said, may not enter that conversation for reasons that are not necessarily about like scientific reasons and has to do with political, cultural, ideologic reasons. But we have seen so many challenges at the systems level, Dr. Lindo, in terms of even getting a grasp of the scope of that problem, that issue. So, for example, there has always been a question in the field, just how many people, just simple count, how many people per year get shot by the police? We have severe underestimation of that in the field,
Right.
whether they're fatal or non-fatal. So if you ask me just the count, I don't know the answer to that question. They're estimation, but we know that they are heavily underestimated and we are missing so many. Now, there are some resources by some different media or some, for example, Washington Post or The Guardian and others that's trying to collect fatal cases when people get shot by the police and die. But that's just a slice of it. There is a much larger group of people who get shot, and we really don't know much about non-fatal injuries. There have been calls by members of the community and leaders also in the field to collect data from that, from the law enforcement agencies or other mechanisms to come up with a better estimation of that. But from the systemic point of view and systems perspective, many hurdles have been created for this to actually happen. And so that's a big picture at the national level. But then there are community or neighborhood level studies or others that have looked at the impact of this, or studies that are really not about estimation of the count, but they say, well, at least for those that we do know, what is the impact of that? And they have shown the negative impact, especially among Black and Brown communities, their negative impact on mental health and physical health. There are studies, for example, that have looked at the police shooting of unarmed Black men. This was a national study that was done using behavioral risk factor surveillance system. And they asked the respondent to the survey, the Black respondent, and they compared their mental distress reported by Black respondent whose interview date was in the proximity in time to that unarmed Black person getting shot in their community. And they can clearly see profound negative impact of police shootings in those communities. So there are some here and there, but the infrastructure to create that is so weak, and the political will to make that data set complete has been so absent, and that we have some foundational issues related to what's called legal intervention. So not suicide, not the interpersonal group under homicide, they call illegal intervention in injury and violence research, has been very much neglected. And I think really requires continuous calls to change that.
Yeah, thank you so much for that, Ali. And I think you're absolutely right. And maybe that is a call at the moment to how do we do it on our end, on the back end, perhaps even in the hospital, of solidifying the codes when patients come in. I know I've said on a few panels where coroner officers don't even have a code to put if there is a mortality as state acted death, or as you mentioned, legal death. So yeah, thank you so much for that answer. I really appreciate it.
Thank you so much, Dr. Linda, for being here. I wanted to react to a couple of things. Choose 180, absolutely. We work with Choose 180, an amazing group of people, thought leaders and change makers, and we work with them pretty frequently. So thank you for mentioning Choose 180. I also wanted to react to the first comment, is that I don't know if that question was about, or it was answered about whether there's a do we have representation of the partners in the leadership? And so I'm happy to answer that question now or follow up later. I don't know if this leadership, if it's related to the leadership, which leadership this is referring to.
Is Adriana still on this call? If not, I left the emails as well, and we can always follow up with that person. But sorry we didn't get to everything in the chat. But I want to give everyone the rest of their day, and thank Ali and Julia again so much for coming and giving this talk and spending the hour. Thank you so much.
Thank you so much for having us.
All right.
Take care.
Thank you.
Thank you.
Very much.